Or flu is a virus which tends to circulate in winter months. And whilst we're only too well aware of COVID, we mustn't forget about flu. This is a different virus from the coronavirus that causes COVID. And whilst COVID-19 is considered to be a much more contagious disease, flu can affect you just as badly, and so it's really important to prevent it. Similar to coronavirus, for most it causes what's commonly described as a flu-like illness, with symptoms of muscle aches, chills, fatigue, fever, headaches, sore throat, a runny nose, or a cough, and it can last up to a week. However, in some, it can lead to complications such as breathlessness and pneumonia, requiring hospital admission and prove deadly.
We have known about seasonal influenza for some time, and as such there may be some immunity in our communities already. Wearing face masks and keeping 2 metre distance apart will be helpful in reducing the spread of both flu and COVID-19. However, there is also a well-established vaccine which reduces the chances of catching influenza. It is so important that we do not assume that this is a lesser virus, and people who are recommended a vaccine by the healthcare provider take them up on this offer. The flu vaccination programme is recommended for all at-risk adults.
So as we find that COVID-19 cases are on the rise, the importance and value of immunisation against influenza has never been more important than in this flu season to prevent you from becoming unwell. If you are deemed to be in a higher risk group, it is important to protect yourself as the risks of complications from flu are higher. It prevents you from potentially infecting a vulnerable contact or a member of your household.
There's a theoretical risk that if you are infected with influenza, you may become even more unwell if you were to catch COVID too. In an average winter, fewer than 1% of cases with flu die, compared to 3.4% of patients with COVID, but on average, 17,000 people a year. This is nonetheless not insignificant if it affects you or your family. If you are able to develop viral symptoms during winter months and have had a flu vaccination, it may be easier for health professionals to attribute the cause to COVID, leading to safer and more effective management of the condition. This will help reduce numbers of influenza admissions to hospitals, allowing them to have a greater capacity to manage patients with COVID-19.
There are 3 different vaccines recommended for different categories of patients. The first one is a nasal flu for young children. The second one is a quadrivalent vaccine which fights against 4 common strains of influenza in younger patients for under 65s. A trivalent vaccine is for over 65s, which covers 3 strains of the virus. This is designed to fight against strains encountered by the older age group and provide a greater antibody immune response. This is not a live vaccine. If you have egg allergies or are a vegetarian, please speak to one of the staff about which vaccine may be more appropriate for you.
I've heard the influenza vaccine gives you flu.
This is not true. The vaccine is designed to create an immune response in the body so that if you do come into contact with the flu in the future, your body will have memory of the vaccine response to fight the infection without you becoming unwell. Most people don't have any troublesome symptoms following the vaccination. For some, they experience a sore arm, mild fever, mild body ache and mild headache. This tends to last no more than 2 to 3 days.
Well, the vaccine protects me against COVID.
This vaccine is for a different virus, influenza or flu, which is common during the winter months.
If I had COVID, can I have the flu vaccine?
There is no evidence to date that the vaccine causes harm to anybody who has had COVID.
I don't need the vaccine because I never get flu.
This is all about prevention and designed to protect you. We do not know how fatal this year's flu pandemic will be and how COVID will impact on the spread. The more people who have the vaccine, the less flu will spread in communities, and if you are at risk, the risk of developing problems from flu or influenza are higher than ever this year.
The vaccine is recommended in the UK for the following groups of patients. Patients aged 2 and 3, or those who are over 65, for pregnant women and those who are very obese. It's also for people who have certain conditions, including chronic heart, kidney, liver or neurological disease. If you have diabetes or you're immunosuppressed due to certain treatments. It's for those who are staying in nursing homes or other long-term care facilities and the people who work there, and also for the household contacts of anybody who is shielding or immunocompromised.
If you're in one of these groups, please contact the surgery as soon as possible to get your flu jab. We are now also vaccinating patients between 50 and 64 as part of a new government programme, but priority is to vaccinate those at risk first. So if you are in a high risk group, please do contact the surgery to get your flu vaccine.
Flu vaccines are now in stock for all high risk patient groups. If you are currently not in an eligible group, there may be private healthcare providers who have stocks of vaccine and will be able to vaccinate you.
The sooner you make an appointment for your flu vaccination, the better. Please be assured that the clinical areas are cleaned and it is safe for you to attend your appointment. Social distancing is in place for your safety. The clinician administering the vaccine will be wearing PPE and will sanitise their hands after every contact. Please wear masks when attending your appointment and let us know about any reasonable adjustments you may need.